Yes, good afternoon, all of you. This is Maslah Mohammed Abdi, one of the students of Smith University. Today in here, I would like to record the course assignment presentation for the subject of science and technical research and methodology. I'm one of the students of Open University Malaysia for the master program, especially project management course. With the participation or with the facilitation of Simon University, first I would like to thank and acknowledge the Dr. Yunis who facilitated this course. This is the outline of our presentation that we will cover today. We will discuss about the research topic that we have taken as a research proposal. We'll make some introduction. We'll look some overview of the problem statement. We'll look also research objective and research questions. Some literature review, theoretical framework, methodology, study area, data collection, sample and method of analysis that we will use in our assignment. The research topic that we have chosen is level of COVID-19 knowledge, attitude, and practices among faculties, faculties of health science students in some selected universities in Banat regional state. We look the CAP survey for some of health science students in some selected universities of Banat region. The reason that we have selected the topic is it depends on the current waves of COVID-19 and the escalation of COVID-19 that exists in the country. And also, we selected to know more about the disease or the pandemic disease that affects many of the communities in Somalia and throughout the world. Introduction, as you know, COVID-19 is a pandemic disease which became an excessive threat to public health. It's impacted the study and the life of the globe totally. According to WHO, COVID-19 spread more than 200 countries in the world and declared it as a pandemic on 30 January 2021. And also December 7, 2021, there were a number of 66,243,918 confirmed cases, as well as 1,528 for 984 deaths in the world. And Somalia, as we know, the first case were confirmed on March. The highest confirmed cases were observed in Banadr compared to the other regions, where Banadr was 1,619 cases and 59 deaths as reported for the central government of Somalia. The purpose of the study aim is to assess the knowledge, attitude, and practices related to COVID-19 disease, as well as numerous studies have been reported from several countries regarding CAP about COVID-19, but data on the knowledge, attitude, and practice toward COVID-19 among the Somali people are still not clear. Hence, there is a serious need to gather such crucial data for effective control, preventive plans. The results of our study are essential to notify future efforts for central community willing to obey with pandemic and control actions. Problem study. According to the WHO report, today more than 5.5 million cases and 343,334 confirmed deaths were recorded in the world. Somalia is one African countries that have been hit by the COVID-19 epidemic. In June 23, the country has had 2,416 cases of COVID-19 and 85 deaths, with a majority of deaths falling between the ages of 60 to 70. To facilitate the outbreak management of COVID in Somalia and to gain better education methodology that friendly for the pandemic are highly needed at this critical time. Also, in here, we look at the objective of the research and the question is the major objective of the research is to assess the level of knowledge and practices that threats COVID-19 healthy science students. Also, the objective is to compare the level of knowledge, attitudes, and practice towards COVID-19 of these universities and their students, and also to compare practices towards environment based on gender between health science students. The research question that we will use is what's the level of knowledge, attitude, and practice towards COVID-19 health science students. Also, the major questions that we will use include is there a significant difference in the level of knowledge, attitude, practice towards COVID-19 health science students, and also we'll look at the significance or difference in the level of practice based on gender between health science students in these universities. This is the theoretical framework of our study. This is the independent variable, which has three dimensions. Knowledge is one dimension that we look in our study. Also, attitude is another dimension, and practice is another dimension. Which all this is IV of our research. Also, this is the DV COVID-19 is the impact and it is the dependent variable of our research. This is the theoretical framework of our research. Methodology, the study area, the research evaluates the level of CAP among the faculties of health science students in some select universities at Banadr administration. Sample population of this study will drawn from in Banadr regional state, especially the universities include 5 common universities. First university is Banadr University. Second university is Mogadishu University, Somali National University, Zee University, and Somali University or UNISOP. Data collection that we'll use is questionnaire, which will be done by administering questionnaire to students for the selected universities of the show. The sample size that we will study, we will use our study is 100 students of these 5 universities, which will be randomly selected to represent the sample unit and the whole generation. The data analysis we use to data analysis quantitative approach, especially data collected. The data collected will be analyzed using SPSS, especially for 16. Also, we'll use descriptive statistics will be used to analyze data to assess the demographic characteristics and determine level of COVID-19 CAP practices among students of these universities. And this is the final of our presentation. Thank you for your listening.